Hello guys, welcome to Rebuild Academy. My name is Adil Monu and I welcome you to the 14th part of our series From Virus to Vaccine, Let's Fight Infodemic. I hope you all are doing well, fighting pandemic as well as infodemic. But before we begin, let me tell you a very important point. It is extremely important and highly recommended to watch this series in order. Only then you will get a complete idea and a clear picture of every concept involved. The link is given in the description. Now, let's begin. In the previous video, we talked about post-COVID conditions, the major possible conditions that people can experience after recovering from COVID, in which we mainly discussed long COVID, multi-organ effects, and treatment effects of COVID. After which we talked about mucormycosis and briefly gone through its diagnosis, treatment, prevention, and risk factors. Then we discussed post-traumatic stress disorder, that is PTSD, and briefly went through its symptoms, treatment, and risk factors. Today we will start our discussion on pandemic, the word probably you were eager to hear. In this topic, we will mainly talk about stages of pandemic and its different phases. Also a brief history of the major pandemics in history. Moving forward, we will learn about different terms involved in the assessment of severity of pandemic like mortality rate, and after which we will talk about the stages of control of pandemic. This will primarily give us an idea of the probable way the COVID pandemic will end by looking at previous pandemics, and in the end we will discuss different concerns about possible future pandemics, the factors involved, and the potential measures that should be taken to ensure limit the risk. Okay, then let's begin. When a contagious disease spreads across international borders, then it is considered a pandemic, but there are few confusing terms involved here, representing different stages of pandemic. Let's look at them one by one. The first one is epidemic. When a disease affects a large number of people, then it is called an epidemic. While an epidemic remains limited to one city, region, or country, a pandemic spreads beyond national borders and possibly worldwide. Examples of epidemics include cholera, malaria, dengue, measles, SARS, and MERS epidemics. But when an epidemic crosses the national boundaries and spreads globally, it turns into pandemic. A new virus strain or subtype that easily transmits between humans can cause a pandemic. Bacteria that becomes resistant to antibiotic treatment may also be behind the rapid spread. Sometimes pandemics occur when new diseases develop the ability to spread rapidly, such as the Black Death or bubonic plague. Examples of pandemics include cholera, swine flu, smallpox, and COVID-19. Seasonal influenza epidemics generally occur as a result of the strain of a virus that is already circulating among people. Novel strains, on the other hand, generally cause pandemics. A pandemic affects a higher number of people and can be more deadly than an epidemic. It can also lead to more social disruption, economic loss, and general hardship on a wider scale, as we are seeing today. A disease is said to be endemic when it is constantly present in a specific region and periodically appear at a specific time of the year when it gets favorable conditions. For example, malaria is endemic in parts of Africa and dengue is endemic in India, whereas chickenpox is endemic in the US. When a disease is endemic, then there is a certain number of cases that are expected each year, and if cases remain below that limit, then it is supposed to be in a controlled state. But if any year we witness a sudden rise in cases, then it is called an outbreak. For example, dengue or malaria outbreak. The term outbreak is also used when we encounter a new contagious disease whose spread is limited to a particular area. For example, Ebola outbreak. So, these were the stages of pandemics based on the reach of disease. But flu pandemics can also be tracked based on stages of infection. The WHO is responsible for announcing the emergence of a new pandemic based on how the spread of the disease fits into the following 6 phases. In phase 1, the viruses that circulate in animal populations and haven't been shown to jump to humans, they are not recognized as a threat and the risk of pandemic is low. In phase 2, humans are found to be infected by a novel animal virus that was circulating among animal populations. This new virus is seen as a threat, indicating the possibility of a pandemic. Through animal to human transmission, the animal virus has infected a limited group of humans. Human to human transmission at this stage is insufficient to create community outbreaks. This indicates that while the virus poses a threat to the humans, it is unlikely to result in a pandemic. In phase 4, the new virus has been transmitted from person to person in sufficient numbers to cause community outbreaks. This type of human-to-human transmission indicates a high risk of pandemic trying to develop. In phase 5, the new virus has been transmitted in at least 2 countries in the WHO region. Even though the new virus has only affected 2 countries so far, a global pandemic is unavoidable. In phase 6, the new virus has been transmitted in at least 1 more country in the WHO region. This is known as the pandemic phase and it indicates that a global pandemic is currently taking place. As shown above, pandemics are defined by the spread of the disease rather than their growth rate. Understanding the rate of spread of a pandemic, on the other hand, can help health officials prepare for an outbreak. Many disease outbreaks follow a pattern of growth or spread known as exponential growth. This means they spread quickly over a short period of time, days, weeks, or months. Think of driving a car and pressing on the accelerator pedal. The further you travel, the faster you go. That's exponential growth. Many initial disease outbreaks, like the 1918 influenza pandemic, seem to follow this growth pattern. Throughout the course of history, disease outbreaks have ravaged humanity, sometimes changing the course of history and at the times signaling the end of entire civilizations. Here are some of the worst epidemics and pandemics. The Black Death traveled from Asia to Europe, leaving devastations in its wake. Some estimates suggest that it wiped out half of the Europe's population. It was caused by a strain of bacterium Yersinia pestis that is likely extinct today and was spread by fleas on infected rodents. The bodies of victims were buried in mass graves. The Black Death's last major outbreak in Great Britain caused a mass exodus from London. The plague started in April 1665 and spread rapidly through the hot summer months. By the time it ended, about 100,000 people, including 15% of the population of London, had died. 7 cholera pandemics have occurred in past 200 years, with the first pandemic originating in India in 1817. Between 1816 and 1923, the first 6 cholera pandemics occurred consequently and continuously over time. Increased commerce, migration, and pilgrimage are credited for its transmission. Deaths in India between 1817 and 1860 in the first 3 pandemics of the 19th century are estimated to have exceeded 15 million people. Another 23 million died between 1865 and 1917. During the next 3 pandemics, late in this period, particularly 1879 to 1883, Major scientific breakthroughs towards the treatment of cholera developed: the first immunization by Pasteur, the development of the first cholera vaccine, and identification of the bacterium Vibrio cholerae. There have been 5 influenza pandemics in the last 140 years, with the 1918 Spanish flu pandemic being the most severe. The Spanish flu has an unusually deadly influenza pandemic caused by H1N1 influenza A virus, lasting from 1918 to 1920. It infected 500 million people, about a third of the world's population at that time, in 4 successive waves. The death toll is typically estimated to have been somewhere between 20 million and 50 million, making it one of the most deadliest pandemics in human history. The 1957-58 Asian flu pandemic was a global pandemic of influenza A virus subtype H2N2 that originated in southern China. The number of deaths caused is estimated between 1 and 4 million worldwide. A decade later, a mutated viral strain H3N2 further caused the Hong Kong flu pandemic in 1968-69. The most recent, the 2009 swine flu pandemic, resulted in under a million deaths and is considered relatively mild. It's called swine flu because in the past, the people who caught it had direct contact with pigs. In 2009, H1N1 was spreading fast around the world, so the WHO called it a pandemic. Since then, people have continued to get sick from the swine flu, but not as many, so you can say it is an endemic stage. 1/4 of the world's current population has been infected with Mycobacterium tuberculosis, and new infections occur at a rate of 1 per second. About 5 to 10% of these latent infections will eventually progress to active disease, which, if left untreated, kills more than half of its victims. Annually, 8 million people become ill with tuberculosis and 2 million die from the disease worldwide. TB is still one of the most important health problems in the developing world. In 2018, tuberculosis became the leading cause of death from an infectious disease with roughly 1.5 million deaths worldwide. It is also one of the endemic diseases. AIDS has claimed estimated 35 million lives since it was first identified. HIV, which is the virus that causes AIDS, likely developed from a chimpanzee virus that transferred to humans in West Africa in 1920s. The virus made its way around the world, and AIDS was pandemic by the late 20th century. For decades, the disease had no known cure, but medications developed in the 1990s now allow people with the disease to experience a normal lifespan with regular treatment. Even more encouraging, 2 people have been cured of HIV as of early 2020. Ebola ravaged West Africa between 2014 and 16 with 28,600 reported cases and 11,325 deaths. The first case to be reported in Guyana in December 2013. Then the disease quickly spread to Liberia and Sierra Leone. The bulk of the cases and deaths occurred in those 3 countries. There is no cure for Ebola, although efforts at finding a vaccine are ongoing. In early 2015, a widespread epidemic of Zika fever caused by the Zika virus in Brazil spread to other parts of South and North America. It also affected several islands in the Pacific and Southeast Asia. The Zika virus is usually spread through mosquitoes of Aedes genus, although it can also be sexually transmitted in humans. While Zika is usually not harmful to adults or children, it can attack infants who are still in the womb and cause birth defects. The type of mosquitoes that carry Zika flourish best in warm, humid climates, making South America, Central America, and parts of the southern US prime areas for the virus to flourish. In the meantime, scientists face a race against time to find a cure. Once a novel virus is identified and is spreading from person to person in a sustained manner, public health officials use the Pandemic Severity Assessment Framework (PSAF) to determine the impact of the pandemic or how bad the pandemic will be. There are two main factors that can be used to determine the impact of a pandemic. The first one is transmissibility, or how easily the pandemic virus spreads from person to person. The second factor is clinical severity, or how serious is the illness associated with the infection. These two factors combined are used to guide decisions about which actions are recommended at a given time during the pandemic. The transmissibility is calculated using parameters like basic reproduction number, R0 number. The basic reproduction number of an infection is the expected number of cases directly generated by one case in a population where all individuals are susceptible to infection. That is, if you place an infected person in a population, then how many people are supposed to get infected from this person is R0 number of this infection. Suppose if one person can infect 5 other people, then the R0 number will be 5. But there are two assumptions here. The first is no other individual are infected or immunized, and the second is no deliberate interventions is done in disease transmission, that is using a mask or sanitizer etc. in the case of COVID. So basically, when it is tried to find out the maximum possible spreading ability of a virus when given a free run, it is important to note that the R0 number can vary for different strains of the same virus. Therefore, if we say the mutation has increased the transmissibility of the disease, then it means the R0 number has increased, and we will see how even a small change in R0 number can make a big difference. In reality, the assumptions used in the definition are not valid. There would be deliberate interventions in virus transmission, and some population will eventually get immunity either from natural infection or through vaccination. To account for this, the effective reproduction number is used, usually written as RT, which represents the average number of new infections caused by a single infected individual in time t in the partially susceptible population. It can be found by multiplying R0 number by the fraction S, which represents population that is susceptible. For example, assume 50% of the population of a certain country have developed immunity either by natural infection or by vaccination. This implies still 50% is susceptible to infection, and assume the R0 number of the virus is 4, then RT will be R0 multiplied by S, that is 4 multiplied by 0.5 equals to 2. This means a single infected person is infecting 2 other persons in the real world. Now, assume susceptible population decreases. This implies S will decrease, which in turn decreases RT. Suppose the S value becomes 0.2, that is only 20% of the population is susceptible, then RT value will come out to be 0.8, which is less than 1. This means a single infected person is infecting less than one other person. That is, the infection has stopped spreading. This is when we say herd immunity has been achieved and the number of cases occurring in the population will gradually decrease to 0. So, this is fine till now, right? Now, assume a new variant of the same virus comes whose R0 number is 7, and assume the immunity of the previous variant is still useful for this variant also, which will keep the S value the same, otherwise it can also change. So, the new RT value will come out to be 7 multiplied by 0.2 equals to 1.4, which is more than 1, indicating the infection will start spreading and herd immunity doesn't exist anymore. Now, you will understand why herd immunity is so delicate matter and we should primarily concentrate on vaccination. The R0 number for COVID is estimated between 3 and 8. Another parameter used for determining transmissibility is doubling time. It is the time taken by infection to double. This is particularly important in tracking the growth rate of disease. Serial interval is one of the parameters used to find transmissibility. It refers to the time between successive cases in a chain of transmission. It is a time between a person gets an infection and transmit it to others. For COVID, serial interval is estimated between 4 to 8 days. Now, if we talk about another factor of pandemic severity assessment framework, clinical severity, then it can be measured by a couple of factors like hospitalization rate, which measures how many people who got the disease needed hospitalization for a treatment, and the most important one is the case fatality rate, CFR. It is the proportion of deaths from a certain disease compared to the total number of people diagnosed with the disease for a particular period. A CFR is conventionally expressed as a percentage and is most often used for diseases with discrete, limited time courses, such as outbreaks of acute infections. For example, if 100 people in a community are diagnosed with the same disease and 9 of them subsequently die from the effects of the disease, the CFR would be 9%. It is important to note that CFR can only be considered final when all the cases have been resolved, that is either died or recovered. Therefore, we can only estimate the CFR value based on current data if the disease is still prevalent. Like the case fatality rate, the term infection fatality rate, IFR, also applies to infectious disease outbreaks, but represents the proportion of deaths among all infected individuals, including all asymptomatic and undiagnosed people. It is closely related to the CFR but attempts to additionally account for asymptomatic infections. The IFR differs from the CFR in that it aims to estimate the fatality rate in both symptomatic and asymptomatic people. So the fatality rate that the government releases is CFR and not IFR, and that's logical because estimation of IFR will require accurate data of asymptomatic deaths, which might not be practically possible, but that doesn't change the fact that those people have died due to infection and are still not counted. You can call it the limitation of the system, but utilizing mathematical models, IFR can be estimated. It is important to note that CFR will always be lower than IFR because while calculating CFR, we are not considering the deaths of asymptomatic infected people. This means it is almost certain that more people have died than the official numbers released by the government. If you ask how much more, then I would say it is a topic of research, and surely some studies will come up with calculations to give us an estimate. Another point that should be noted is the mortality rate, often confused with CFR. The mortality rate is a measure of the relative number of deaths, either in general or due to specific cause, within the entire population at a given time. A CFR, in contrast, is the number of deaths among the number of diagnosed cases only. You might have heard about infant mortality rate. It indicates the number of deaths per 1000 live births of children under 1 year of age, that is, number of children dying before crossing the age of 1 year in 1000 children born in particular period. Infant mortality rate in India is around 28, which is gradually decreasing over the years. Now coming back to CFR, and if you talk about the CFR of COVID, then it is important to note that CFR will change as you move from country to country because the number of infections and the number of deaths will be different. Also, it changes in a given country from time to time as pandemic is going on and infections and deaths are happening over time. So, till now there is no constant value of CFR till the pandemic is over. Now there is one concept called excess deaths which you might have heard recently. Excess deaths are typically defined as the difference between the observed number of deaths in a specific time period and expected number of deaths in the same time period. For example, if you want to know excess deaths due to COVID in 2020, then you have to count all the deaths in 2020 and subtract it from the total deaths that happened in the previous year, that is 2019. So excess deaths give the deaths that happened due to COVID directly as well as indirectly. The people who died due to COVID are considered as deaths directly related to COVID, and the deaths from other causes occurring in the context of healthcare shortage or overburdened healthcare systems are attributed as indirect deaths due to COVID. For example, if a person died due to TB, but he could have been saved if the medical system would be available for his treatment, which is occupied for COVID treatment, then this can be considered as indirect death due to COVID. Another possible scenario is a person is recovered from COVID, but his immune system is so weak that he died subsequently due to other diseases. By this logic, the deaths due to mucormycosis or black fungus are indirect COVID deaths because those people would not got mucormycosis if their immune system was not weakened by COVID. So, excess death is a parameter that helps us to understand the overall loss of human lives due to pandemic. Researchers from the US-based Center for Global Development estimate India's excess deaths during the pandemic till June 2021 is anywhere between 4 to 5 million, which is 10 to 12 times more than the COVID deaths. So you can imagine the actual damage caused by COVID, therefore it is considered as the worst tragedy. If we talk about waves of a pandemic, then there is no official definition what constitutes a wave in a pandemic. It is generally used to define the rising and declining trends of infections over a period, since the new cases often rise gradually to reach a peak before it declines slowly. It resembles the shape of a wave. The term wave is often used to describe a period when infection or a disease rise and come down and resurge again later after a period of lull. So, what causes these rises and lows? One of the possible explanations is when interruptive measures are taken like lockdown, social distancing, using masks, then this breaks the chain of infection, causing the number of infections to fall. And when these measures are not followed, then naturally the infection rate increases. But this is not as simple as this. The virus variants and proportion of the susceptible population also plays a role in the waves of the pandemic. Now to understand how will pandemic end, it is crucial to realize how we humans deal with the pandemics in modern times. The first stage of pandemic control involves control over growth of pandemic. This is done broadly by using two strategies. First, utilizing interruptive measures like lockdown, social distancing, wearing masks, using sanitizers, etc. And second is developing a treatment method like a vaccine in case of infectious diseases. By using these methods, the pandemic is brought under control to such a level that the available health infrastructure will be able to withstand the disease load. When this stage is reached, we say the disease is in the endemic stage. In the endemic stage, people will still get infections, but the disease will not spread in a larger population. But sudden outbreaks are possible, for example, due to mutations of the pathogen. And many diseases remain in an endemic stage for years and even for decades. Every country has its own list of diseases that are in an endemic stage in that country. India has at least 14 diseases in the endemic stage, including dengue, leprosy, and rabies. The disease is said to be eliminated in a particular geographic area when the incidence of disease cases has reached almost zero. This is achieved by continuous, deliberate efforts and measures to prevent the re-establishment of transmission. For example, in case of TB, according to WHO, the number of cases should be less than one case in 1 million population. For instance, if India reports less than 137 TB cases annually, then it will be assumed that TB is eliminated from India, which India is trying to accomplish. India has successfully eliminated polio in 2010. The last stage is eradication. A disease is said to be eradicated when the incidence of disease cases has reached almost zero at the global level. And this is achieved through consistent, deliberate efforts at the global level. And you would be surprised to know that there is only one infectious disease that has been eradicated till now, smallpox. So, you can imagine how difficult it is to eradicate a disease. Even if we can eliminate a disease, then that can be considered as a plausible achievement. Now coming back to the question of when COVID will end, then it is important to realize that COVID is currently out of control. First, it needs to be brought under control such that our health infrastructure can manage the number of infections. For this purpose, we have to use both strategies, that is implementing interruptive measures and secondly employing mass vaccinations, after which COVID will reach the endemic stage. And when will this happen? It is difficult to tell exactly, but most probably by the end of this year, you can expect at least in developed countries, COVID will reach the endemic stage. But these are just speculations for now. It will be foolish to prematurely claim anything because such claims can cause complacency in people. You can see the example of second wave of COVID in India. But even if COVID will be endemic, the baseline cases will be seen annually like influenza, and people are expected to take precautionary measures. And elimination and eradication are the topics that are less relevant in the current scenario because obviously we will require deliberate continuous efforts at the country as well as global level, which will happen gradually and take considerable time. So if you ask when we will be able to live normal pre-COVID life, then I would say it depends on how quickly people get vaccinated and get adopted to certain lifestyle changes and hygiene practices. But I can assure you this is going to happen sooner or later. But in the meantime, let us learn about pandemic prevention. Do you know that a pathogen can travel from a remote village to major cities on all continents in just 36 hours, which is just 1.5 days? So, we can say the next pandemic is just 1.5 days away. So, how can we ensure our safety? Consider you are doing an air journey. How will you ensure your safety? The first kind of safety will be provided through an aeroplane that it should not fail, and even if it fails, then the most of the passenger lives should be saved, for example by using parachutes. This is the second kind of safety. Therefore, there are two fronts on which we have to work to make a future pandemic less probable and less devastating for us. To reduce the chances of future pandemics, we have to look into the factors that are responsible for increasing the feasibility of a pandemic. Let's look into some of them. The first one is zoonosis. A UN report of October 2020 on biodiversity, written by 22 experts in a variety of fields, said the destruction of biodiversity due to deforestation and hunting is paving the way to the pandemic era and could result in as many as 850,000 viruses being transmitted from animals in particular birds and mammals, to humans. Therefore, zoonosis is one of the major factors influencing the chances of future pandemics. We had a detailed discussion on zoonosis and how we can prevent it in our series. The second major factor is antimicrobial resistance. Antibiotic resistant microorganisms, which sometimes are referred to as superbugs, may contribute to the re-emergence of diseases that are currently well controlled. For example, cases of tuberculosis that are resistant to traditionally effective treatments remain a cause of great concern to health professionals. Every year, nearly 500,000 new cases of multi-drug resistant tuberculosis (MDR-TB) are estimated to occur worldwide. China and India have the highest rate of MDR-TB. The WHO reports that approximately 50 million people worldwide are infected with MDR-TB, with 79% of those cases resistant to 3 or more antibiotics, deeply worrying the health experts. Another important factor is global travel and trade. Globalization has its disadvantages also. The fast-moving world with so much connectivity not only helps people to travel quickly but also enable the pathogens to rapidly transmit within population. It's been 75 years since the last and only nuclear attack that has happened, and in today's world, nuclear weapons are mostly lost their charm, kept around for only symbolic value. The new nuclear weapon of today's world is biological weapons. Biological weapons are microorganisms like viruses, bacteria, fungi, or other toxins that are produced and released deliberately to cause disease and deaths in humans, animals, or plants. Bioterrorism attacks could also result in an epidemic. For example, if Ebola or Lassa viruses were used as the biological agents. To counter this bioterrorism, there should be coalition at the global level. So, these were some of the major factors responsible for increased chances of future pandemics. If we talk about second, safety, that is when pandemic hits, we should not be taken by surprise, for which we have to take certain measures. The first one is building surveillance system. There should be a proper surveillance system at the global level for rapid detection and reporting of any disease cases. Such a system will be beneficial in identification of pandemics in the early stage and can help in timely containment. The second measure is the establishment of laboratory networks that can accurately identify the cause of illness and help us to determine if there is any novel pathogen that is responsible for the outbreak. This can truly aid researchers to get preliminary data to assess the severity of disease and characteristics of the pathogen. Also, this can greatly help in formulating strategies to minimize the pathogen transmission. One of the most important steps that are needed to be taken is the formation of trained workforce. This workforce will be provided special training to identify, track and contain outbreaks. This workforce may include special medical staff for identification and management of disease, epidemiologists who will track the pandemic and analyze its nature, also law enforcement agencies who will try to contain the spread of disease. And to all these to work in tandem, there is a need of creation of emergency management systems that will coordinate an effective response. For example, there should be a system coordinating ambulance service, bed availability, oxygen and medicine supply. So, these were some of the steps that should be taken to prevent a future pandemic. So this brings us to the end of today's discussion. Now as usual, let's quickly revise the topics we discussed today. Today we started our discussion on pandemics. We saw different stages of the pandemic as epidemic, endemic and outbreak. Then we also talked about 6 phases through which an infectious disease can turn into a pandemic. Moving forward, we went through a brief history of pandemics and got to know some major pandemics in human history like Black Death, cholera pandemics, and flu pandemics. We also saw some epidemics, especially Ebola and Zika virus epidemics, which have the potential to be the next pandemic. After which we discussed the pandemic severity assessment framework. We saw how transmissibility is measured by using different parameters like basic reproduction number and saw how it is linked to herd immunity. We also looked into how clinical severity is measured by using factors like case hospitalization rate, case fatality rate, and infection fatality rate, and also saw how CFR is different from IFR, and the actual number of people who died due to infection is hard to calculate because it requires accounting for asymptotic deaths. Then we discussed stages of pandemic control, how a pandemic is controlled by utilizing interruptive measures and mass vaccination, and made endemic, and people learn to live with it. Elimination and eradication of diseases require continuous deliberate efforts for a long time, and in the end we saw how we can try to prevent the future pandemic by using two approaches. First, by reducing the chances of happening a pandemic by working on factors that are directly linked or encourage the pandemic, and other by effectively controlling and managing the pandemic. This can be done by adopting certain measures like surveillance systems, laboratory networks, trained workforce, and emergency management systems. The next video will be our last video of the series, in which we will talk about COVID and mental health. It is the most neglected and underrated aspect of COVID, so make sure you subscribe the channel and press the bell icon for timely notifications. If you enjoy and learn something from this video, then make sure that you like the video and share it with others so that we all work together and battle the infodemic. If you have any suggestion for me, then you can comment below. That's all for now. We will meet in the next video. Stay safe, stay connected.